I'm Dr. Jacob Juta. I'm a minimally invasive bariatric surgeon, and I'm also a general surgeon. I'm board certified general surgeon as well as certified by the American Society of Metabolic and Bariatric Surgery, the ASMBS, which is the foremost bariatric society in the United States. The goal of bariatric surgery is really to treat obesity. It's not just about weight loss, it's about treating the diseases that are brought about by obesity. Really what obesity does to the human body is it affects every single physiology of the human body and causes dysregulation in the metabolism. So patients that are obese tend to deal with hypertension, diabetes, migraines, polycystic ovarian syndrome. They tend to deal with infertility, and there are also a host of mental issues that go along with it, which is why a few years ago obesity was formally classified as a disease. For most individuals, bariatric surgery is the most effective treatment, sustainable treatment for obesity. And so this is part of the reason why I got into this field, and I was very passionate about it, because in essence we're saving lives. I have also included in my practice endoscopy because I feel like that is the trend that bariatric surgery is moving towards, is mostly in endoscopy and more minimally invasive treatment of obesity. Obesity has been a moving target, has been for many years. New procedures have been added to this field, but essentially most of the procedures we provide, not just here at Olmsted Medical Center but across the country and indeed the world, can be classified as either restrictive procedures, meaning they restrict the amount of calories patient taking, or malabsorptive procedures, meaning they restrict the amount of calories patients absorb. And here at Olmsted Medical Center, we provide the laparoscopic sleeve gastrectomy, we provide the Roux-en-Y gastric bypass, we do the adjustable band procedure here, and various endoscopic treatments as well. So really, for anyone thinking about bariatric surgery, it is a very standardized process across the country. Here at Olmsted Medical Center, we try to follow those standardized practices. Our patients typically will begin by getting a referral either from a friend or from their primary care provider. We do have a bariatric coordinator here that will get in touch with those patients. We then send them to an informational session where we have an informal meeting with the rest of the new referrals, where patients can ask questions but also get a generalized introduction to our program here at Olmsted Medical Center. After that, then they get appointment with the surgeons. We have a very short introduction where we go over their medical history. And then these patients will then have a 6-month of a compliance period where they see the dietitians once a month. Our minimum here at Olmsted Medical Center is 6 months, where they go through a rigorous diet and exercise regimen. It is crucial for those patients to have that period of time to prepare themselves, not just physically but mentally, not just for the surgery but also for postoperative progression. After this procedure is performed, the patients are really our family for life. One of the things that we aim here at Olmsted Medical Center is when the patients get referred to us, we want them to feel like they're instantly part of the family. Okay, we want to treat them with compassion, we want to treat them with respect, we want to be honest with them as well, and also for them to know that if they're part of us, they're really going to be here, not just figuratively, but literally, a family here at Olmsted Medical Center Bariatric Program. I say that because even after their surgeries, even after the first year where they come in at 3 months, 6 months, and a year, we want to see them back here on a yearly basis. I think, to me, I love this job because I feel like it's part of who I am. I think for you to be a doctor in the United States of America, it's almost like a calling. And I feel like I'm making a difference in people's lives, and I also enjoy what I do. With bariatric surgery, for instance, when we treat patients, we're treating heart disease and we're treating things that could lead to cancer. And the changes that we see in our patients' life is what makes me want to come to work every day.